in sedentary young adults measured in closed kinetic chain position.
Good afternoon, everyone. I'm Pausian, and today my group will be presenting our study on the effects of warm-up on knee joint position sense in sedentary young adults when measured in a closed kinetic chain position. I'll be going through the introduction and our study, and Hasina will take you through our results and discussion later. So now on to the introduction proper. In a recent study in the UK, recent survey in the UK, it was found that only 1 in 5 out of 3,605 active individuals actually performed warm-up. And this is despite warm-up being a well-accepted practice for the enhancement of physiological performance. So this is probably because there's a lack of knowledge of warm-up as a means of injury prevention. And so there's a need to emphasize to the general public the importance of warm-up. So this is a brief overview of our study, and firstly we'll be looking at how warm-up improves knee joint position sense, which is also known as knee JPS. So JPS is a subcomponent of proprioception, and an improved proprioception by the augmentation of neural activation can improve movement accuracy. This helps to reduce the risk of injury, and it can be achieved by warm-up, as shown in a study by Megalis and his colleagues that showed an improvement in knee JPS by 39% in warm-up. So we'll now look at how knee JPS can be measured. This can be done in the open and the closed kinetic chain position. But for our group, we have chosen the closed kinetic chain position, which is also known as the CKC position. This is because it is more functional, as it involves mechanoreceptors that act in concert during our daily activities. It is also more accurate, reliable, and relevant to the clinical context, where the patient's functional capacities is measured under weight-bearing conditions. Also, in light of the fact that only one study assessed the effects of warm-up in knee joint position sense in the closed kinetic chain position, there is a need to increase the amount of evidence that proves the efficacy of knee JPS assessment in a closed kinetic chain position. So now that we have seen how knee JPS can be measured in a closed kinetic chain position, we'll look at how warm-up can improve agility. So agility is defined as the ability to effectively perform a combination of start, stop, and direction change. And this was chosen as our second variable because it is highly dependent on coordination and movement control, which require proprioceptive input from muscles, joints, and other receptors. So an improvement in agility will help with better control of the body, so that within a split second, an injury can be prevented or the severity of it can be reduced. So while most studies look at how knee JPS can be improved by warm-up in athletes, we wanted to find out if warm-up will also improve knee JPS in sedentary young adults when measured in a CKC position. So sedentary young adults, as defined above, were chosen because of their not so developed proprioceptive acuity, which is due to their poorer motor control, which puts them at a higher risk of injury. So now that we know that warm-up improves both knee JPS and agility, which are both essential to the prevention of exercise-related injury, it is crucial to emphasize the importance of warm-up. Also for us as physiotherapists, the importance of this study is heightened, because we often recommend exercises to our clients, but this is without the emphasis of warm-up as a means of injury prevention. So bearing in mind that warm-up improves knee JPS and agility, we wanted to find out if an improved JPS because of warm-up will also mean an improvement in agility. So one of the purposes of our study is to find out whether warm-up would improve knee JPS in sedentary young adults when measured in a CKC position, which leads us to our first hypothesis that states that a structured warm-up will improve knee JPS in sedentary young adults when measured in a CKC position. Another purpose of our study is to examine the relationship between improved knee JPS post-warm-up and improved agility, which leads us to our second hypothesis that states that there is a positive relationship between an improved knee JPS and post-warm-up and an improved agility. With that, we'll now move on to our study. For our study, 57 sedentary NYP students were recruited, and we screened them with the following inclusion and exclusion criteria. From there, 33 of them were included, and informed consent was given. Then they underwent the pre-intervention measurements of knee JPS and agility. So we'll now look at how the knee JPS measurement procedure went. We used a biometric electrogoniometer and attached it to the lateral aspect of the dominant knee. But before that, we had to palpate the greater trochanter, the lateral epicondyle of the femur, the head of the fibula, as well as the lateral malleolus. We marked them out and joined them with straight lines, which acted as references for the attachment of the electrogoniometer. The electrogoniometer was then attached using masking tape and double-sided tape. Then the subjects had to stand on their test leg and flex to the target 45-degree knee flexion. They had to hold that position for 3 seconds to remember it, then replicate it 3 more times, with the absolute error measured on the 3rd time being recorded. And all these were done with the subject's eyes closed with their 2 fingers shoulder width apart, placed lightly on a walking frame in front of them. So we measured agility using the t-test as shown above, and we used the stopwatch to time subjects as they ran from cone A to B to C to D and back to A again. So after these pre-intervention measurements were taken, subjects underwent a warm-up that consisted of a series of runs, jumps, and stretches. This was taught to them by one tester, and this protocol was adapted from a study by Megales and colleagues in 2010. So after the warm-up, subjects underwent a post-intervention measurement of knee JPS as well as agility t-test again. And with that, I'll hand my time over to Hasina.
Thank you, Pausian. So now I will bring you through the results of our study. Please take note of the definition of absolute error because it will help you in the understanding of our results later on. So what is absolute error? Absolute error is the response angle minus the test angle. So for our study, we got the subjects to flex their knee to 45 degrees, remember that position, and then this 45 degrees is the angle that was used throughout the whole test procedure as the test angle. So the response angle is then the angle that the subjects managed to replicate based on memory. So the closer the response angle is to the test angle, the better. So, for example, pre-warm-up, subject A manages to replicate a response angle of 48 degrees. So, as you can see above, the absolute error will be 48 minus 45 degrees, which gives us 3 degrees. After the warm-up, subject A manages to replicate to a response angle of 46 degrees. So, post-warm-up, the absolute error would be 46 minus 45 equals to 1 degree. So as you can see, there is a reduction in 2 degrees in the absolute error post-warm-up, which is desirable because we want the response angle to be as close to the test angle as possible, as mentioned earlier, and this would then indicate that knee JPS has indeed improved. With this in mind, our results first compared the absolute error of the knee JPS pre and post-warm-up. So, following warm-up, we actually found that the mean absolute error decreased from 4.4 to 2.6 degrees, which is an overall mean improvement of 40%. These results are statistically significant with a p-value of 0. Secondly, our results compared the mean agility t-test timings pre and post warm-up, which is an overall mean improvement of 5%. This would mean that our subjects completed running the agility t-test faster after the warm-up. A faster t-test timing will indicate a better agility. However, very weak correlation was found between the difference in the mean absolute error and the difference in the mean agility t-test timings pre and post warm-up. So this means that when there is an improvement in knee JPS, it does not necessarily mean that the mean agility timing will improve as well. With these in mind, we will now move on to the discussion. So for our study, hypothesis 1 is accepted, but hypothesis 2 is rejected because there is a negative relationship between an improved knee JPS and an improved agility. So, why did a structured warm-up improve knee JPS? Physiologically, the improvement in knee JPS is attributed to the central and peripheral components. Centrally, warm-up contributes to better proprioception by changing corollary discharges likely involved in position sense. Peripherally, warm-up has a positive impact on the function of muscular mechanoreceptors by improving viscoelastic properties of muscular tissue, enhancing oxygenation, and increasing the nerve conduction rate. Our study concurs with the only 4 studies that examine the effects of warm-up on knee JPS. Out of these 4 studies, only 1 study by Magalhaes and colleagues assessed knee JPS in CKC position in 2010, as mentioned earlier. Our results concurred with theirs, showing a parallel significant reduction in the mean absolute error post-warm-up, which means that knee JPS improved in both studies after a warm-up. However, Magalhaes and colleagues only conducted the study on 10 karatekas, whereas we conducted a parametric study on 33 sedentary young adults. Due to a larger subject size, our study would be an important contributor to the pool of evidence supporting CKC position as a better assessment of knee JPS after a warm-up. However, we still face limitations in our study, one of which is the possibility of an increase in effort during the measurement of absolute error pre and post warm-up. Subjects were required to adopt a single leg stand position, flex their knee to 45 degrees, and stay there for 3 seconds. This may have resulted in reduced muscular control of the knee during measurement because sustained muscular contraction causes fatigue. However, we did not objectively measure the fatigue level during the test itself. Secondly, precautionary measures were taken to prevent the possibility of errors during the removal and reattachment of the electrogoniometer pre and post warm-up. However, it is still possible that the electrogonio shifted during the measurement post warm-up due to the subject's sweaty skin. Yet, we still use the electrogoniometer because of its portability, making it very convenient for us to conduct our entire study outside of lab conditions. Future research can consider measuring the effects of warm-up on knee JPS in CKC position, but using the 2D video motion analysis as the measurement tool instead of the electrogoniometer. This is to prevent possible errors arising from the reattachment of equipment post-warm-up, because the 2D video motion analysis uses a marker that will stay on the subject's skin throughout the entire test procedure. We would like to end off with the following warning. This is what happens if you don't do your warm-up. So, just do it. Thank you.